Hi, my name is Brian Hoeflinger, and if you're watching this video, you probably saw me in the office regarding your neck or lower back. I realize that you may still have questions regarding your condition, so I created this video as a reference guide for you. In this video, I am going to review a representation of your films and describe your surgery in detail. I will go over all the postoperative care instructions and discuss treatment options that you could consider other than surgery. Lastly, we will go over all the risks and benefits of surgery, and I will hopefully answer any remaining questions that you may have had. Again, I want this video to be a recreation of your office visit and to be used as a reference guide for you, your family, and your friends. This is an MRI of the lower back, and we're looking at it from a side view. So down here is the tailbone, and then there are 5 bones of the lumbar spine. This is the 5th lumbar vertebra, the 4th lumbar vertebra, 3rd, 2nd, and 1st bone. In between the bones are the dark spaces, which are the disc. And again, we're looking in from the side. So this is the tailbone down here. This is the front of the abdomen. This is the outside of the back. If you look here, you see this white stuff, which represents the spinal fluid in your spinal canal. And a normal size spinal canal would be areas such as here and down here. That's how the normal size of the spinal canal should look. But where the spinal stenosis is, you can see that there's narrowing of the spinal canal, which is what the definition of spinal stenosis is. That means narrowing of the spinal canal. And you can see there is severe narrowing of the spinal canal at this level between the 4th and 5th bone in the lower back. So this is a good example of severe spinal stenosis. This next picture is looking at your spine from a different view. This picture shows us looking straight down the center of the spinal canal. So to get you oriented, this would be the front, this would be the back, this is the spinal canal. The white stuff is the spinal fluid in the spinal canal. The little gray dots are the nerve rootlets within the spinal canal. This structure here that looks like a wishbone, that's actually bone over the back of your spine. And so when you push on your back and you feel that bump in your back, that's actually this part of the picture right here. That's a part of the bone that sticks out in your back. So we're looking straight down the center of the spinal canal. And I just wanted to show you an example of a normal level where the spinal canal looks normal size. So this is normal size spinal canal that we're looking at here. Now, this is the same type of image. We're again looking from a top-down view straight down the center of the spinal canal. So this would be the front, this would be the outside of the back, and we're looking straight down the center. So at this level, this is a level where there's spinal stenosis. So instead of seeing the round white structure, which represents the spinal canal, we see this gray area here. And it looks gray because the fluid around the nerves has been squeezed because of the stenosis, and so the spinal canal is much smaller at this level. So this is a good example of severe narrowing of the spinal canal, which is spinal stenosis. This is a model of the spine of the lower back. We're looking in from the outside of your back. To get you oriented, this would be up, this is down, your tailbone area would be down here. These protrusions that you see here that I'm pointing at, these are called spinous processes. So when you feel your back in the middle and you feel those firm bumps in your lower back, those are the spinous processes, which I'm pointing at here. Attached to the spinous process on either side is the lamina. Here and here would be lamina. And then out to the side of that would be the joints of the spine called facet joints. So this is the spinous process, this is the lamina, and this would be the joint. Now, when I perform surgery for spinal stenosis, what I typically do is I take bone off of both sides of your spine. So I resect either a portion of the lamina on both sides, or often I'll remove the whole spinous process with the entire lamina on either side. And I take that bone right off the back of your spine. By doing that, that opens up your spinal canal and that unpinches the nerves on both sides. So again, when you have a laminectomy done for spinal stenosis, typically I'll take the entire bone off of both sides of your spine, including the spinous process, to open up your spinal canal. Patients undergoing this type of surgery will either go home the same day or stay overnight. We will often make this decision together on the day of surgery. If you do go home the same day, I will discuss discharge instructions in detail with you and your family. This will include things such as wound care and dressing changes, activity after surgery, and follow-up instructions. If you do spend the night, then I will see you in the morning and we will go over these same discharge instructions at that time. I am including these instructions in this video for you to use as a reference guide. First, let's talk about wound care. Your incision will be closed with either dissolvable stitches or staples, which we will let you know before you leave the hospital. I will have you keep your incision covered with a dressing and ask you to change your dressing once a day for the first 3 days after surgery. Typically, you will have a fresh dressing placed prior to leaving the hospital. I ask you to leave this dressing on overnight and not to shower until the following morning. On the second day after your surgery, you may shower with the dressing on. After you shower, you will take your wet dressing off and replace it with one of the clean dry dressings we provided for you. Be sure to let your incision dry completely before you put the new dressing on. So you will change your dressing once each day starting the second day after surgery, and you will do this for 3 days in a row. After 3 days of changing your dressing, you no longer need to wear one, and you may shower without a dressing regardless if you have dissolvable stitches or staples. Remember, if you went home the same day of your surgery, then you will not change your dressing until the second day after your surgery. If you do have staples, then you will need to call my office to schedule an appointment for 2 weeks after surgery to have the staples removed. Of special note, patients can experience a small amount of drainage from their incision for up to 1 week after surgery. This is not unusual, and we ask you to keep your incision covered for the time period while this is occurring. If you experience a fever greater than 101 degrees Fahrenheit, chills, excessive redness or breakdown of your incision, or even excessive drainage from your incision including the presence of pus, please contact our office at that time. Again, it is normal to have a slight degree of drainage occurring on your dressing, but this drainage should not be excessive and should not saturate your dressing. If this is to occur, please call our office. Now, let's discuss activity after surgery. I would ask that you keep your lifting light. I would like you to lift no more than 5 to 10 pounds for the first month after surgery. Just think about a gallon of milk weight-wise as a good guide and try to keep your lifting no more than that. You may be up walking around the house and go up and down stairs several times a day. If you feel up to it after several days, you could even go out to dinner or go to the grocery store for short periods. Walks no more than 30 minutes would be fine. If you drop something, you can certainly bend down slowly and pick it up, but I would try to avoid excessive bending. When you get to the point where your muscles start to ache or you feel fatigued and tired, you should sit down and rest. The first month after surgery, you will feel tired and maybe even exhausted. Most people certainly feel this way. Your back should feel sore. In addition, you will most likely experience a degree of discomfort remaining in your buttock, hips, and lower extremities. The intensity varies from patient to patient. Overall, the majority of patients will continue to feel tired and sore for the first month after surgery, so please expect it. Things I would like you to avoid for the first month after surgery would be primarily heavy lifting and excessive bending. Remember, I would like you to lift no more than a gallon of milk weight-wise. I don't want you to formally exercise this month. The first month should be a time for you to take it easy and keep your activities light. Your body definitely needs time to recover. I would ask you to wait at least 2 weeks after surgery before getting back to driving. This is primarily because of pain and the use of pain medication. You shouldn't drive while taking pain medication. Another important thing to remember is your symptoms that you had before surgery, particularly in your buttock, hips, and lower extremities, can fluctuate the first 2 to 4 weeks after surgery. For all of these reasons, it isn't safe to drive for the first several weeks after surgery. You will be provided with pain medication and a muscle relaxant to go home with after surgery. Typically, I like to use Percocet or Norco for pain and Xanaflex as a muscle relaxant. Pain medication can often cause constipation, so I would recommend using an over-the-counter stool softener such as Colace or Pericolase. These medications can be purchased at your local drugstore and can help prevent constipation. I also recommend that you drink plenty of water after surgery to keep yourself well hydrated. All of these measures will help to prevent constipation. After your surgery, you will have several follow-up visits to my office. Your initial visit is typically at 1 month after surgery. At this visit, we will discuss increasing your activity. You can start light exercises, including light workouts such as working on an elliptical machine, treadmill, Stairmaster, or even a stationary bike. Light yoga, light stretching, and lifting of light free weights no more than 30 pounds would be fine. You can begin light housework, including pushing a sweeper or mopping the floor for up to maybe 15 to 30 minutes. Light laundry and cooking is fine. It would be fine to do light gardening outside or mow the grass for say 15 minutes. In the fall, you could rake the leaves, and in the winter, even shovel very light snow for 10 to 15 minutes. Walking is fine, but not to exhaustion. I would avoid jogging for at least another 2 to 4 weeks at this point in time. The most important thing after surgery is giving your body time to heal. If you do too much activity too soon, you could strain your muscles and cause yourself undue increased pain. The need for physical therapy will be determined based upon how you are feeling at your 1 month visit. Some people require physical therapy and others don't. If you do undergo physical therapy, I typically include a 6-week course consisting both of water therapy in a warm pool and the other half land-based therapy. Additionally, we will check your incision to make sure you are healing properly. And lastly, I will answer any remaining questions that you have regarding your surgery. The first month after surgery is very tiring and you need to expect it. You will be worn out and maybe even exhausted. You won't have your normal energy levels, and that's perfectly normal during this time period. You typically will have a second postoperative visit to my office 3 months after your surgery. If you are doing well at this visit, I would release you back to near normal activity. Activities such as golf, tennis, jogging, biking, and even riding a motorcycle are all examples of activities that you could start now. However, I may hold restrictions for a bit longer for people who engage in aggressive activities such as long-distance running, vigorous exercise programs like P90X, or activities that involve heavy lifting. At your 3-month visit, I will re-examine you, including checking your incision, and I will answer any remaining questions you may have. On occasion, you may require a 3rd visit if you are having problems or you need additional x-rays for some reason. Typically, I will see you back 6 months after surgery for this extra visit. If we did discuss treatment options other than surgery, these may have included things such as physical therapy, including water and land-based therapy. We may have talked about working with a chiropractor, massage therapy, acupuncture, traction, and treatment through pain management, including the option of steroid injections. Although these non-surgical options are available, they are usually not long-term solutions when you have pain or symptoms due to a pinched nerve or pinched spinal cord. As with any surgery, there are risks. We talked about many of these risks during the office visit. Typical risks for your lower back surgery would include things such as bleeding, infection, nerve injury, permanent weakness, paralysis, no change or worsening of your symptoms, recurrence of symptoms requiring further surgery. There could be an injury to a blood vessel requiring a blood transfusion. Other risks of lower back surgery could include things such as bowel or bladder dysfunction or a spinal fluid leak requiring repair. There's also a risk of anesthesia, a risk of a heart attack, risk of blood clot formation, there's a risk of pneumonia, and there's always a small risk of death. I realize that this list may seem very daunting to you, but I have performed thousands and thousands of spine surgeries over the past 20 years, and so I feel comfortable in telling you that I think you will do well from your surgery. But I can never say 100% there couldn't be a complication. That's a part of having surgery, and there's always that small risk.